Since last August, Ebola has infected over 2,600 people and killed nearly 1,700 people globally. Doctors Without Borders have also revealed that approximately a third of Ebola-related deaths so far have been diagnosed post-mortem, while on average 6 days pass between the onset of the symptoms and the time a patient is admitted into an Ebola treatment or transit center, a time during which a patient's conditions deteriorate and the virus can be spread to infect others. Why then has the response so far failed to control this epidemic despite having tools at its disposal?
The outbreak is eating in the areas with armed groups, which makes everything difficult to control and difficult to access people, the communities who are in the very far places.
Experts say that since the beginning of this outbreak, insecurity has been mentioned as a significant challenge for the intervention.
There are many cases of attacks on health facilities have been reported, and this is known, which prevent health actors to go further or to reach those one in very difficult places.
Northeastern DRC has been an area of active conflict for the past quarter century and is rife with armed groups. Most centers also lack the capacity to provide quality, individualized care during the waiting period for the Ebola test results. Roland Kaya, a representative from Doctors Without Borders, says expanding access to the investigation of vaccination being used in this response might act as a remedy.
A lot of communications, a lot of sensitization, a lot of community integration, and that proximity would give them more trust to come forward and say what they see in the community or report potential cases, suspected cases.
And 1 year on, health officials regret that the situation on the ground is still wanting. In July this year, for instance, between 80 and 100 people were diagnosed with the disease each week in DRC. Uganda saw its first Ebola patients who had traveled from DRC in June, while Goma, a city of 1.5 million people, recorded its second case just this week. The 10th outbreak in DRC since the discovery of the virus in 1976 was declared on 1st August 2018. It is the first outbreak in North Kivu and Ituri provinces, and it went on to become the second largest in history, following the 2014 outbreak in West Africa, as well as the largest in DRC history. Purity Museo, Channel 1 News.